Dannemiller presents the Dannemiller Hawaiian Anesthesia Seminar 2017.
Is that we were driving our needle straight towards the cupula of the lung. So with the classic technique as described, we're going immediately from cephalad to caudad. And with the use of ultrasound, now we're going from lateral to medial. I'll show you how that's changed dramatically.
And I certainly don't do a CSE any place above L3-4 with the knowledge that I'm very likely off by 1 or 2. Which is better, CSE or epidural? As I said, I think the major benefit of CSE, unless you're really going for that sacral effect.
In-hospital non-cardiac surgery who had one or more of these 5 factors: known disease, peripheral artery disease, stroke, undergoing major vascular surgery, or 3 of any of these factors, which include smoking, hypertension, diabetes, TIAs, heart failure. These were high-risk patients, patients with known coronary disease or risk factors.
He has stopped prescribing. The state medical board is investigating, surrendered his passport, and he did something really stupid. And if you are ever charged with a crime, do not go on television.
We were both trained on propofol, and we were experienced and comfortable with its use.
Really?
Nephrologist about this. So remember our patient? This was one of my hotline calls. Okay, I was called by the anesthesia provider in the plastic surgeon's office. Actually, I was called by the nurse because the anesthesia provider, who was a CRNA.
For more information, please visit us at dannemiller.com. This has been a Dannemiller Video Network presentation.